Acute hepatitis usually resolves within 6 months or less. The most common causes of hepatitis are one of 5 non-taxonomically related viruses, known as hepatitis A, B, C, D, and E. Hepatitis A spreads when people ingest something that has been contaminated by the stool of an infected person. Hepatitis A has an acute phase, but not a chronic phase. Even though it can take several weeks or months for someone to recover completely from hepatitis A, they have a lifelong immunity afterwards. Complications from hepatitis A are rare but usually limited to the people who have chronic liver disease or those who have received a liver transplant. Hepatitis B is spread through contact with blood or bodily fluids from an infected person, such as when people share unsanitized needles when using IV drugs. This disease has 2 phases, an acute phase, which lasts a couple weeks, and a chronic phase, which can last years, leading to cirrhosis, liver failure, liver cancer, and even death. Acute hepatitis B has a 5% chance of leading to chronic infections in adults. Hepatitis C is sometimes called a non-A, non-B hepatitis. Hepatitis C is an infection that goes undetected until it has done significant damage to the patient's liver. This infection is divided into 2 phases, an acute phase and a chronic phase. The majority of patients clear the virus from their bodies during the acute phase, but 60 to 80% have a chronic hepatitis C infection, which can lead to cirrhosis, liver failure, liver cancer, and even death. Hepatitis D is generally rare in the United States. It has 2 phases, an acute phase and a chronic phase. Hepatitis D occurs at the same time that hepatitis B develops into its chronic phase. Hepatitis E usually spreads when people ingest something that has been contaminated by the stool of an infected person. Often, this is drinking water. It is also known as non-hepatitis A or B. There are at least 2 strains of hepatitis E, one found in Asia and the other in Mexico. The virus starts in the intestinal tract, but then grows mostly in the liver. On rare occasion, acute illness damages and destroys so many liver cells that it can lead to liver death. This condition is called fulminant liver failure and may cause death. The great majority of patients who recover from the acute infection do not continue to carry hepatitis E virus and cannot pass it on to somebody else.
Patients with acute hepatitis may have symptoms that go unnoticed or simply don't have any symptoms for a long time. As a result, it often takes a long time for these infections to even be detected at all. These symptoms, such as general malaise, weight loss, anorexia, nausea, vomiting, abdominal discomfort in the right upper quadrant, headache, low-grade fever, rash, jaundice, pruritus, may be intermittent or ongoing. If jaundice is present, the urine color may darken due to the increase of excess bilirubin being excreted by the kidneys. Pruritus may also accompany jaundice because of the excess bile salt that is accumulating beneath the skin. This acute phase often lasts from 1 to 4 months. There's only one definitive way to determine which viral hepatitis a patient has, and that is through blood tests. Blood is drawn and tested for specific antigens or antibodies, as can be seen in this table. For example, for Hep A, a blood sample would show positive for immunoglobulin M. For Hep B, blood would show positive for hepatitis B surface antigen, the hepatitis B E antigen, and or the antibody to the hepatitis B core antigen IgM. For Hep C, the blood would show a positive result for the antibody to hepatitis C. For Hep D, the results would show positive for the antibody to hepatitis D. For Hep E, the blood would show positive for the antibody to Hep E, immunoglobulin M and G, and then for Hep B and Hep C, viral genotype testing can also be done. If a patient has acute hepatitis, blood liver tests can also be abnormal, such as AST, ALT, GGT, and bilirubin. They'll all be elevated. Physical assessment is also really important in order to diagnose this patient. A healthcare provider will look for hepatic tenderness, hepatomegaly, splenomegaly, and a liver biopsy is really rare unless the diagnosis is in doubt.
Common medications. There are no drug therapies for treating acute HAV hepatitis infection. However, some patients may choose to treat their acute hepatitis C infection using one of the direct-acting antivirals. The direct-acting antivirals listed above prevent viral replication in genotype 1 of the HCV virus, which is the hepatitis C virus. Supportive drug therapies include antihistamines. Antihistamines block the effects of histamine at the H1 receptor. They help the patient who has hepatitis with their itching, which is a common occurrence. Vitamins. Vitamins K and B6 also help the liver. Vitamin K can be ingested by adding foods that are rich in vitamin K to their diet. Some foods high in vitamin K are asparagus, broccoli, spinach, cabbage, kale, and Brussels sprouts. Anti-nausea medications. The patient may be put on anti-nausea medications. One of them is promethazine. It is an anti-nausea medication whose therapeutic effects are to relieve the symptoms of histamine excess, usually seen in allergic conditions, and diminish nausea and vomiting. Ondansetron is also another one. It is used to prevent nausea and vomiting. If the patient has severe nausea and vomiting, IV solutions of glucose or enteral nutrition therapy may be used. It is important to maintain fluid and electrolyte balance in a patient with acute hepatitis.
As nurses, we must think of the disease process as a whole and how it is affecting our patients to provide effective care. Although hepatitis in its most simple sense describes inflammation of the liver, this disease process has implications on the entire body system. As such, when determining a nursing diagnosis for these patients, one must consider the effects that this inflammation has on the entire body. The liver is responsible for many functions within the body, including management of waste metabolites, synthesis and activation of proteins and enzymes for digestion, as well as other body functions. When the liver is inflamed, these processes are altered. Waste products build up in the body. The patient develops altered protein balance and fluid shifts. One of the most evident signs of this process is related to the metabolism of bilirubin and the buildup of bile salts, causing significant yellowing of the tissues, known as jaundice, and significant fluid shifts, seen in things such as ascites. Some of the less evident things that are happening in the body are related to balanced metabolism. Electrolyte, carbohydrate, protein, and lipid metabolism become altered. Hepatitis is a chronic process that is usually taking place in our patient over a prolonged period of time. When we see the patient, it may be during an acute exacerbation, seen with things like heavy drinking or other opportunistic infections, or for the initial diagnosis after inoculation with the virus. This being the case, some of the patient's symptoms might be vague, prolonged problems like fatigue, itching, or generalized pain. Therefore, when determining a nursing diagnosis for acute hepatitis, it is less likely that we will choose things like sepsis or hypovolemia, although these can be endpoints of the disease, and more likely that the patient will be more concerned with things like fatigue or imbalanced nutrition from the infection that's going on. They'll also be complaining of issues that deal with altered metabolism or acute pain from the swelling of the liver, irritation of bile salts, and waste metabolites. Complications related to hepatitis are systemic and can range from annoying to life-threatening. Some of the obvious symptoms, like jaundice and pruritus or itching, are problems that the patient might find uncomfortable but still be able to deal with. The patient might not even seek medical care during this phase of the disease. However, as hepatitis goes untreated, more serious complications may result. One of the most dangerous situations surrounding acute hepatitis is related to fluid balance. Commonly, patients with acute hepatitis are experiencing loss of appetite, abdominal pain, nausea, vomiting, and diarrhea. This can lead to very unstable fluid and electrolyte shifts within the body, and physical findings such as edema or ascites may result. This, coupled with altered protein metabolism, especially lack of albumin, can cause intravascular depletion, and acute hypovolemia may result. Along the same lines as fluid and electrolyte shifts, altered nutrition can present several complications of this disease. These patients, due to altered intake and processing of nutrients, may develop significant fatigue or weakness doing activities that normally require little thought or effort. This results in patient decreasing their own self-care, hygiene, exercise, social life, etc. Not only is this unhealthy from a diet and exercise standpoint for the patient, but patients with the complications of hepatitis may also develop a certain amount of social isolation, opening doors to additional psychological issues that may need to be addressed. Another commonly seen yet dangerous complication of hepatitis is the effects that the inflammation in the liver has on the surrounding tissue and vasculature. This inflammation damages tissues and puts the patient at risk for infection. Infection can often become systemic and life-threatening. Additionally, as tissue inflammation occurs, stress and pressure on the portal vascular system increases. This increase in pressure leads to a decrease in the strength of the surrounding blood vessels and can lead to hemorrhoids or esophageal varices, which may lead to the primary presentation of GI bleeding in patients with hepatitis.
Collaborative treatments. Most patients can be monitored at home. There needs to be an emphasis on proper nutrition and eating regular meals. One way for the patient to keep their energy levels up is to eat small meals or snacks at least every 3 to 4 hours. The patient should also increase their protein. Increased protein helps to fight off infection, and protein helps heal damaged liver cells. The patient also needs to rest their body so their liver can regenerate and repair itself. Rest decreases the metabolic demands on the liver and improves liver cell regeneration. Counseling should also be advised, especially if the patients drink alcohol. They should be encouraged to quit drinking. Counseling should also include contacting those who may have come into contact with the patient and are at risk for contracting the hepatitis infection. Nursing treatments. The patient must be assessed for complications and manifestations which can include bleeding tendencies with an increase in prothrombin time. That is a test that measures how much time it takes the blood to clot. Manifestations of encephalopathy, sudden increase in weight or abdomen size, which could indicate ascites or fluid retention, bloody or tarry stools, or elevated liver enzymes. Patients need teaching on how to prevent transmission to other family members, and the teaching also needs to include signs and symptoms and what they should do if they occur in their loved ones. Reinforce teaching on adequate nutrition and alcohol cessation and why this can impact care. We also need to advise the patients on following all the healthcare providers' instructions and why it's important for follow-up care for at least a year after diagnosis, because relapse can occur with hepatitis B and C. Teaching also needs to include symptoms of reoccurrence. The patient also needs to know if they are positive for the HBsAg, which is the chronic carrier status, they cannot donate blood.